There we are. Good morning, Carver Kim. I am the Communications Director with the Iowa Department of Public Health. I have Dr. Patricia Quinlisk with us. She's the Medical Director and State Epidemiologist. And it's kind of, as you can see outside, it's a gray, gloomy day today in Des Moines. And I know we have several people home ill at the health department today, so we still see the flu bug, don't we?
We are still seeing the flu. Unfortunately, the flu is continuing to go up. So I don't even think we've hit the peak of our flu season yet. In fact, if I had to guess, I'd say it could be another couple weeks before we hit our peak.
Really? And when do we usually see peak of the flu season?
I would say typically end of January, early February, and this year is probably going to be more like end of February, early March.
For anybody who wasn't with us last week, what are the main things you're telling people to try to get that peak down and to get people well again?
Well, we do all of our prevention stuff. So, of course, we want everybody to get vaccinated. And in case you're wondering, no, it's not too late to get your vaccine. But also, all the time, we want people to follow the 3 C's. And that's, contain your cough, clean your hands, and, stay home if you're ill. So if you've got something that you can spread, you don't spread it at work or at school. So those are the 3 C's that we just want people doing all the time. Right now, if you get some kind of a respiratory bug or maybe even the flu, well, then the best thing to do is to stay home. If you're somebody who's got one of these high-risk conditions, like you're very old, very young, or you've got cardiac disease or lung disease or something, call your healthcare provider right away, because you might be one of those people that needs to be put on an antiviral to make sure you don't end up in the hospital or even dying. And then, other than that, just take care of yourself, rest, drink plenty of fluids, and your body will just have to fight that virus off. But hopefully, within a few days, you'll be back at work.
And talking a little bit about immunizations, we hit a milestone with the child immunizations.
Right. Here in Iowa, we have something called IRIS, and basically it's an immunization registry. So when you go into your doctor's office or into the drugstore or the grocery store and get a vaccine, it goes into our registry. And we do that so that, say you get a job or your kid changes school, you can get your immunization record really fast and really helps just the whole process get through. And in case you were wondering what were those vaccines that I got 5 years ago, you can get that information too. So we keep track of a lot of the vaccines given out in Iowa. I won't say it's 100%, but it's very close. And last week, we hit 1 million Iowans having gotten the flu shot this year, which, when you think we've only got about 3 million people who live in Iowa, that's fantastic.
That's awesome. Hey, I want to say thank you to Trinity Muscatine Public Health. They're sharing our video right now with their viewers, so we want to thank them. If you have a question for Dr. Quinlisk, go ahead and type that in, and we'll pass that along to her right now. But let's talk a little bit about some of the other things that you deal with in public health, because it's not just influenza. This time of year, it's kind of dominating things. But talk about this case we had last week, a disease you don't hear about very often.
Well, that's right. We had a traveler who was traveling in the Caribbean and came back with cholera. Now, that's a disease we don't hear about very much, but to be honest, we have a case every year or so here in Iowa, always in a traveler, because we don't have it indigenous here to Iowa. And this person had been traveling in the Caribbean, and we do know there's a couple places in the Caribbean where cholera is right now, but this person didn't go to any of those places, so we're not real sure how this person picked it up. But they did, and cholera makes you pretty down sick, unfortunately. Now, the good news is, since we have clean water and we have bathrooms, it doesn't really spread in Iowa. So we're sort of a dead-end place. It doesn't go much further. But it does remind all of us that when we're traveling, there's some things we need to do just to protect ourselves against diseases that we normally don't think about.
And part of that is vaccination, finding out where you're going, what vaccines you need.
Well, that's right. If you're planning to travel someplace, one of the best things to do is just go on the CDC website, and that's just cdc.gov. Right at the top of their homepage is Traveler Health. Go in there and say, I'm, a 62-year-old woman, and I'm planning to go over to X country. You put it in, and it will tell you all of the health things that you need to think about before you travel. So that may include vaccines, might include getting medicine to prevent you from coming down with malaria. Might tell you about an outbreak that's going on there right now, and things you might want to do to protect yourself against that outbreak, things like that. And then what you need to do is to go and find those vaccines or that malaria medication. You can try getting it at your own healthcare provider's office, or you can go to a travel clinic. There's travel clinics all over Iowa who specialize in making sure you can travel safely.
Let's talk a little bit about some of the public health issues that have been in the news in the past couple of weeks. One of them, thankfully, and I don't think we deal with this too often in Iowa, but the topic of rats came up in New York City. What was that all about?
Well, rats, like every other animal, has sort of diseases that it can carry and unfortunately can spread to humans. In this case, it was rats in New York City who were spreading a disease called leptospirosis. Now, that's fairly unusual, but just in case you want to know, yes, you can find that disease in Iowa. Every once in a while we have people out, swimming in a farm pond that's really warm and has urine from animals going into it, including from mice and those kind of things. And I'm talking about wild ones here, not your house mouse, but the wild ones that are out there everywhere. And they can pick it up from the water and they can get sick with it. Fortunately, it's a bacterial infection, so you can take antibiotics and you will be able to deal with it, but it's certainly not a fun disease to get at all, and it just reminds us that we need to avoid wild animals. So if you see an animal that's sick, whether it be a mouse or a raccoon or an opossum or a skunk, leave it alone. You don't know what disease it might have, and it might be a disease that can jump to you and make you sick.
Well, and that, I know as spring comes along, we'll start seeing those cute little animals out in the woods and little babies, and we want to leave those alone too.
Well, that's right. Several years ago, there was a family that picked up a wild baby. I think it was a skunk. Could have been a raccoon. Now trying to remember. But anyway, it was a baby. It seemed to be alone. Don't know why the mother was gone. And they brought it into the house and started feeding it and caring for it and got all the children involved in everything. And then the animal died. Well, it turned out it had rabies. So now all those children had to get rabies shots, and that's probably what had killed the mother. So even though this baby at that moment didn't really look sick, it was incubating rabies. So again, just reminds us all, if you see a wild animal that's sick or in trouble, call somebody who's trained to safely handle wild animals. Don't try to deal with it yourself.
We're talking with Dr. Quinlisk from the Iowa Department of Public Health, and we'll wrap up things here with, I know that Robin was excited about this topic, chocolate, and
yes.
Eating chocolate in a mindful way.
Well, as you probably may have read, we are now thinking chocolate is not all that bad for you, especially dark chocolate. So if you want to have a piece of dark chocolate every day or so, that actually could be healthy for you, but don't go overboard. So what that really tells us is if you're going to sit down and just have one little piece of chocolate, you don't want to just chomp it down and swallow it. You want to eat it mindfully. What does that mean? Well, this is sort of a big thing these days, is to do mindfulness. And what that basically means is as you eat that chocolate, savor it, eat it slowly, enjoy the experience of eating that chocolate, and really be mindful about the fact that, boy, I'm eating a really good piece of chocolate and really enjoy it. And then maybe just one square of chocolate will be enough, and that's about all you should eat a day anyway.
Well, and I happen to know personally, Dr. Quinlisk, that you enjoy dark chocolate as a healthy treat occasionally. And
I do.
So if you do it, then it must be okay.
Well, and I will just tell you, we have something we call Dark Chocolate Fridays. So at the end of a week when we've had a particularly bad week, I do go around with a little basket of dark chocolate, and everybody gets to have a piece or two, just to remind us that, yes, you can, give yourselves a little bit of a treat now and then, but you just don't want to go overboard.
Awesome. Thanks for all the reactions, and thanks again to Trinity Muscatine Public Health for sharing our video. And if you have questions for Dr. Quinlisk to answer in the future, just message us on Facebook. And anything else you want to add before we sign off for this week?
No, just hopefully we'll have warm weather for the next couple days and get out and really enjoy it, because I have a feeling it's not going to last too much longer.
You know what? We just got a question from Jim.
Okay.
Jim says, can you talk about the lower efficacy of this year's flu vaccine? Many that have been vaccinated still ended up getting pretty sick.
Well, actually, this year's vaccine had pretty good efficacy. All 4 strains in the vaccine matched well with what we were seeing in the community, which is one of the major concerns that we have about efficacy. But, the flu vaccine, I wish it were a better vaccine. It just isn't. And the flu vaccine's not going to stop every sneeze and sniffle, especially if you have a coworker coughing and hacking in your face and gives you a mega dose of the virus. It's still the best thing we have out there to protect you, and probably this year's vaccine efficacy is going to be somewhere around 50 to 60% in stopping you from having to seek medical care. So what does that mean? Well, you may get a sniffle or two, but you don't get so sick that you have to go and see your doctor. But probably the better efficacy is that it stops you from being hospitalized and it stops you from dying, which is really why that flu vaccine was put together in the first place. As people probably forget a lot, influenza is still in the top 10 causes of death here in Iowa. So it's one of the major things people die of in Iowa, and certainly something that we want to do everything we can to stop from happening.
All right, Jim, thank you for that question. And again, if you have any other questions, message us on Facebook, and we'll talk to you all again soon. Thanks, Dr. Quinlisk.
Thank you.
That's Dr. Patricia Quinlisk with the Iowa Department of Public Health. And thanks for watching today, and be well.